Hi, I'm Kim Russell. The traditional process of making a transition from nursing student to graduate has been procuring a position in a hospital. Today, in our less than robust economy, coupled with the rise in healthcare costs, as well as the necessary cost containment emphasis in hospitals, there have been less job opportunities for nurses in hospitals as in the past. But other opportunities with further education and experience are just opening up, and they offer a tremendous blend of nursing practice and corporate experience. One such area is the insurance industry. Since Hartford is the insurance capital, we want to explore what functions and roles nurses perform within an insurance company and what skills and background an insurance company would require in a nurse. Toward that end, we have contacted the predominant insurance company in the Hartford area, Aetna Life and Casualty, with the help of the Office of Aetna's Health Plan Media Relations and Aetna's Medical Director, Dr. Winchester. We have with us today Kathy Spalla, who is a Utilization Review Manager at Aetna Health Plan Operations in Windsor, Connecticut. Kathy, thank you for joining us today.
It's nice to be here.
Glad you're here. Would you like to tell us more about Aetna Health Plan?
Aetna Health Plans is actually one of the small business units of Aetna Life and Casualty. Our prime focus is in group health insurance. Our office, we have a field office in Windsor, and that's where I'm from, and then our home office, our corporate office, is in Middletown. The Middletown office basically is where all of our policies and procedures for Aetna Health Plans nationwide are developed. Our chief executive officer is located there. Windsor is a field office. What we have where I work is our marketing for the Connecticut and Western Mass area. We have operations, which is member services, customer service, and claims. And then we have utilization management or medical management, and that's the area that I'm in.
And obviously, from what you've told us about Aetna's health plan, there are roles for nurses. And what is the most common role in the terms of numbers that nurses perform within Aetna's?
Well, the largest number of nurses are in utilization management, where Aetna has group health insurance across, we call it across all products. Aetna traditionally, for Aetna health plans, their book of business, so to speak, is indemnity. As the shift nationwide is changing to managed health care, Aetna is joining the ranks and has gone from indemnity, which we call traditional, to PPO, which is a preferred provider, to our network-based products, which is one is called Managed Choice, which is a point of service. And then we have our HMO, which is called Select Choice. Our point of service is basically like an HMO, but the members have the option to go out of network if they choose. The nurses are employed as, we call them healthline nurses on the traditional side, to case managers on the network in our HMO and our point of service. Basically what the nurses do on the indemnity and PPO side is that they interact with the members directly. They do hospital pre-certification.
Okay.
And follow the cases if a patient is admitted in the hospital and interact with the physicians. In the HMO and managed choice, these are what we call network, where you have a primary care physician.
Right.
And in essence, the primary care physician is the director of your care. Our case managers in that service the Connecticut and Western Mass membership. We deal with our providers, primary care physicians. Our case managers do, in essence, the same thing. They do the hospital pre-certification. They do on-site, both on-site and where the nurses actually go to the hospitals. In Connecticut, for instance, we have 17 hospitals that are our network hospitals, and our case managers go to review charts, interact with the various departments within the hospital. For instance, the admitting department, the business office, discharge planning. I lost my train of thought.
Kathy, what about nurses performing in client rehabilitation care?
Aetna does have case managers working in managed disability, long-term care, and they interact again directly with clients, members, and physicians, and they manage long-term care cases and or rehabilitation. For instance, perhaps a client has a traumatic brain injury and needs an extensive, lengthy rehabilitation that an Aetna case manager would follow that through.
I see. And do they at all get involved in trying to get the patient back to work type of issues, workman compensation?
That is.
Do they work that together, the Aetna Health, Group Health, together with workman's comp? Do you know about that?
Actually, no.
Okay.
One of the things is that oftentimes an employer will purchase different products, and that Aetna, for instance, like with rehabilitation, with long-term care, that might be something that an employer purchases, but yet their medical health plans might be managed by an entirely different carrier.
I see.
So that oftentimes it might be more than one insurance carrier that has your medical management coverage. It can get kind of confusing at times, even for us.
Is there a consultant or research function for nurses in claims processing?
There are nurses, RNs and some LPNs, who, for instance, in the field, they are what they call cost containment analysts, where they might look at claims retrospectively and determine what may or may not be paid. In the home office and corporate, this is often instrumental too in setting guidelines for Aetna, again, nationally, because what comes out of our home office, corporate office, is used as guidelines for offices, field offices throughout the country.
And do nurses function in any liaison positions within legal departments and litigating cases?
They, for instance, if there is a case that is pending, Aetna's legal department will use the case managers, for instance, as a consultant. But I do not believe that there are actually nurses employed in Aetna's legal department. I do know, and kind of taking that one step further outside of Aetna, I think that this is a field that is just starting to open up. As you and I were discussing before, nurses who are used in attorneys' offices in the field of medical malpractice. Nurses can go on to become paralegals, and basically with the clinical expertise that they have, plus the legal component, it does open up a whole new area.
Right, and if you know if the attorneys who are litigating cases against insurance companies are using that tactic of using a nurse to help them in their case, you know the legal department and the insurance companies have to do the same.
Right.
The next question I have is when you use the word nurse managers and case managers, I think they're the same thing, is that right?
Actually, the case manager, if you want to take the broad context of it, and I think depending upon the company, kind of like everybody puts their own little tweak on it. A case manager, for instance, in Aetna, we have what we call individual case managers. Those are for catastrophic cases. Those case managers, you kind of hear that terminology in the indemnity and PPO world, if you want to call it, where the nurse consultant who does like the hospital, pre-cert and follows this case through hospitalization, and then potentially it could be a really long, drawn-out case where this is identified as a potential high-cost case for this particular policyholder, that it would be given to an individual case manager, and that is in essence his or her sole function, and it's outpatient. It might be a very lengthy home care case, or it might be a case where They've come out of the acute care setting, a hospital setting, and might have to go to a rehabilitation hospital or maybe a skilled nursing facility, and then still need some further follow-up care. That is an individual case manager. In the products in which I'm involved with, is that we use the term case manager kind of like a broad range, where our case managers, we have case managers that are assigned to what we call hospital networks. Like, for instance, the hospitals that we have, I won't mention them, but the hospitals that we have contracted with us in the state of Connecticut, we have case managers who are assigned to the physicians and the physicians associated with our contracted hospitals. And that what our case managers do is they do the medical management for those members who have either the HMO or a point of service in a particular network in Connecticut. And what they do is they do what we call referral management, where it might be your primary care physician wants you to go see a specialist. And maybe there might be some extenuating circumstances with this particular referral to a specialist, and that the case manager would start following that case. They also, that type scenario, that case that, you might go see, you might need to have open heart surgery. So that they pick up the case then. And then when you are admitted to the hospital, that same case manager who has done your hospital pre-certification reviews your chart. Where I mentioned the telephonic and the on-site, is that our case manager would actually go to the hospital and she would review the chart, or he would review the chart. And then if there was like discharge needs that you might need, like if you've had open heart surgery, you might need what they call cardiac rehabilitation, because you might have some lifestyle changes that you're going to have to get used to. And there's a lot of education. There's your family that gets involved in this also. And that our case manager would basically follow that case through until the member was discharged from services. So that we take the term case manager and we've kind of like added a few job functions underneath it. So that the term case manager is thrown around a lot, and it has a lot of different meanings depending upon the particular product that you might be servicing.
And what skills and background in a nurse would you look for to be a nurse manager or case manager?
Well, obviously they need an extensive clinical background. We're looking for a minimum of 5 years. For our case managers, or if you want to call them nurse consultants on the indemnity side, where they would be doing the hospital pre-certs, there's a tremendous amount of training that Aetna does do for their nurses. So that for the case managers who would be coming in for the indemnity, that they look for 5 years, maybe some hospital utilization review experience. For the network-based products, we're looking for a little bit more in the fact of, again, the minimum of 5 years, like med-surg background. And then either they've done utilization review in a hospital setting. Perhaps they've done discharge planning in a hospital setting. Perhaps they've done discharge planning or been involved with a visiting nurse.
Right.
Or else they've actually done case management for another company. Because in essence, there's a certain skill set that you need to bring to the table, so to speak. And a lot of these things really cannot be taught in a 4-month or 4-week training period. It comes with experience.
And my last question here is, do nurses have input into health plan policy, which might promote the general health of Aetna plan members, or in proposing a standard of care that should be implemented by the subscribers?
We're starting to. Again, I think that traditionally, in Aetna's book of business is that the employer was the one who was directing the care, driving the, they would say, well, yes, we're going to cover this under our healthcare coverage. No, we're not going to cover this. Yes, no. And that the emphasis perhaps was not on wellness. For instance, I mean, you might not you might not have coverage to go see your physician unless you were ill. I mean, I think traditionally people don't go to a doctor unless they're sick. With your HMO and in the average as managed care has started to rise, is that there is more of an emphasis on wellness.
Right, and prevention.
Prevention, where it's a nominal cost. There might be a small, what they call copay, maybe $5 or $10 to go see a primary care physician. That there might be particular wellness programs that your health insurance might have that historically they might not have had. So yes, but again, I think we're still kind of like in the infancy stages.
And one quick question I just want to find out is about, sort of encompasses a lot here, that in nurses that come to the company, would it help them to have computer backgrounds or a master's, hospital experience and public health backgrounds?
We're finding that because, for instance, when I started with Aetna, my exposure to the computer was minimal. I mean, this is how you turn on a computer, and that was it.
Right.
We are becoming much more
dependent on it too. Yeah.
upon a computer system, so that when we have been interviewing, obviously we are looking for, an extensive clinical background. Computer system knowledge really helps a lot.
Right.
It becomes your friend rather than your enemy.
Right. Thank you, Kathy, for agreeing to be interviewed. I appreciate it.
Thank you for having me. Thanks very much.
And in summary, I'd like to say, as you can see from our discussion, there are numerous roles for nurses within an insurance company. Many of these roles may be invisible to nursing students and new graduates. Becoming aware of their existence is one step in realizing the opportunities open to nurses. On behalf of the nursing student team of Nilda Texador, Solveig Phillips, and Joyce Jones, I'm Kim Russell. Thank you for joining us. Thanks a lot, Kathy. I appreciate it.